I yield to the ranking member.
Thank you, Chair. Ms. Sterritt, I want to follow up again with you. The 8 Corners staff have been meeting routinely with Mark Engelbaum, the Assistant Secretary for HR, and our staff has requested a detailed breakdown of data on employees who have left the VA since January through the DRP, VERA, or natural attrition. Unfortunately, the numbers that VA provided as a follow-up fall woefully below the level of detail requested. Are you able to produce by location, occupation, detailed data on the number of employees who have taken the DRP, who have taken VERA, who've resigned, who've retired? Are you able to get that information for us?
Ranking Member Ramirez, yes, I can get that information.
What about the number of job offers that have been declined by applicants since January of this year? Is that a data point that you have the capability of pulling?
So Ranking Member Ramirez, our talent acquisition system is USA Staffing, and it does capture some information on declinations, but it may not provide the detailed information that you're
Okay,
seeking.
so please provide me everything that in fact is being collected. And Ms. Sterritt, can you please commit to working with us on providing the detailed data in a reasonable time?
Ranking Member
Yes.
Ramirez, I welcome the opportunity to work with this.
Great, thank you, Ms. Sterritt. I don't imagine you will have this number on the top of your head, because I'm sure there's a lot going on and a lot of information you have to try to memorize for these hearings. But I want to bring to you an answer. I want you to bring an answer back for the record. How many veteran care appointments at the VA have been canceled since January of this year due to staffing shortages? If you have the answer, I'll take it now. If not,
Ranking Member Ramirez, I do not. I don't know if Mr. Perry does.
do you have that? No?
We do not, but we can
If
take
you can
that.
come back with it, I would really appreciate knowing how many veteran appointments have been canceled. I'm going to leave it at that, Mr. Steele. I really wanted to ask you a question, but I'm hopeful others can. Thank you.
The chair now recognizes Mr. Conway for 2 minutes.
I thought we were changing the order, Madam Chair. Thank you for recognizing me, Madam Chair. Just before I get to one of my questions, I just want to make a comment about HR 1, the big accrual bill, as I call it. I'm very concerned that medical students going to medical school, very expensive process, that there's now a cap on those loans that students may give, and it's going to particularly be a problem for those students who don't come from wealthy families, where they're going to have to try to figure out how to make up that gap. What do you think that this issue of cutting support for medical education, how do you think that's going to impact the VA? You've trained most of the physicians in the country.
So, Dr. Conway, I would say that when we talk about 3 Rs, there are also other incentives, and you speak to scholarship programs, debt reduction programs, and if you look at the job opportunity announcements that are posted for the VA, many of our Veterans Health Administration job opportunity announcement include those benefits. And I'll ask Mr. Perry to...
I'm going to reclaim my time because I want to get another question in. Pardon me for that, but I must push on. In 2024, the VA reported a loss of 608 physicians. So just a series of questions. You may not have them, but I want to get them in before my time is up. How many job postings does the VA currently have for physicians? Do you know by chance? If you don't know off the top of your head, I'll just leave them for the record. How many physicians has the VA onboarded in the past month? What is the VA doing to attract and retain physicians? And why do you think we're seeing such a loss in physicians? And I'll leave it at that. If you have questions to any of those, I see my time is up, but I'll look forward to your answer offline.
We're
The
happy to get
gentleman's
those.
time has expired. The
Thank
chair
you,
now
Madam Chair.
recognizes Mr. Kennedy for 2 minutes.
Thank you. I want to just go back to the secretary and what he said to this committee in May, that the VA would maintain mission essential jobs like doctors, nurses, and claims processors. According to the VA's monthly workforce dashboard, estimated losses for fiscal year 25 are 1,720 registered nurses, 604 physicians, and 1,081 veteran claim examiners. These are mission-critical roles, which run directly against Secretary Collins' points that current and future cuts to the VA won't impact the delivery of care and benefits. As an occupational therapist, I've seen firsthand on the ground what happens when healthcare facilities are short-staffed and that healthcare is not provided to individuals. Right now, our veterans are being provided care by American heroes on the ground in these facilities, but you know what? They're exhausted, and not because they don't care, but because they ultimately are having a trouble keeping up because they're getting cut in staffing. So when that happens in our VA, it's our veterans that are paying the price. And so even though we've been told mission critical employees aren't being cut, evidence on paper is that, in fact, there's a different story. We have credibility issues at the VA and with this administration happening right now. These cuts are impacting veteran care, and veterans should not have to wait longer or see fewer specialists or receive delayed benefits. As members of this committee, we have a sacred responsibility to uphold this nation's promise to our veterans. These cuts are not only short-sighted,
The gentleman's
they're
time has
un-American.
expired.
I yield back.
Mr. Steele and Dr. Elliott, thank you to each of you for coming to testify today. The solution is not just identifying weak policies, but following through with the guardrails that ensure effective oversight. It is clear more attention needs to be focused on ensuring the VA is following Congress's intention when paying these incentives. The fact that we are still having a conversation on this issue after more than a decade since the OIG's 2017 report on improper bonus payments indicates we must do something different. It does not take a rocket scientist to figure out that providing quality and safe patient care is a better use of tax dollars than accounting mistakes. These bonuses, when used correctly, enable the VA to pay attractive salaries to valuable clinical staff and other VA employees who serve our veterans. These incentive payments should go to staff dedicated to providing world-class care for our veterans. When the VA cannot retain its good employees or recruit talented staff, patient care is the first to suffer. I've seen this firsthand as a nurse practitioner. I will not allow that to happen while I am chairwoman of the subcommittee. I'm encouraged that OIG identified better documentation as a means of improving the bonus payment processes as well. Aside from the waste stemming from the improper payments, it is not possible to conduct a thorough review of where processes went wrong when there is no paper trail. That's why I was happy to vote with my House colleagues yesterday for Senate Bill 423, the Protecting Regular Order for Veterans, or PRO Act. This bipartisan bill would provide additional guardrails on incentive payments paid to members of the Senior Executive Service, and I hope the VA will take them seriously. I'm looking forward to further collaboration with Secretary Collins and the Trump administration to assist with our oversight efforts, and I'm grateful for the clarity that today's testimony offers. Ranking Member Ramirez, do you have any closing remarks?
Thank you, Chairwoman. World-class care can't be achieved when you've lost 1,720 registered nurses. Can't be achieved when 1,147 medical support assistant staff leave, or 604 physicians leave, and when asked why they're leaving, they say lack of trust and confidence in senior leaders. The information contained in VA's workforce dashboard is critical to our oversight and to showing the public the true picture of what is happening at the VA under Secretary Collins. It is hard to call us liars and say our claims are a hoax when we have the data from VA to back up concerns that veteran care and benefits are being impacted under Collins' leadership. The information for the public that is listening can be accessed at va.gov/employee/workforce-dashboard. I urge everyone watching this hearing to go now and review the data and make a judgment for yourself on how this administration's actions have and will continue to impact world-class care for our veterans. We know that this administration has a history of deleting or hiding files and tampering with information they don't agree with. So to ensure that these documents remain a part of the public record and are not deleted, removed, or hidden, I request unanimous consent to enter issues 1 through 26 of VA's workforce dashboard into the record.
Without objection, so ordered.
Thank you, Chairwoman, and with that, I yield back.
Thank you, Ranking Member, and thank you all for being here today. Ms. Thurett, Mr. Perry, Mr. Steele, Dr. Elliott, I know you all took time out of your busy schedules, and I appreciate that. I'm sure you were prepared to discuss the real issues at the VA, including the title of our subcommittee, which, just as a reminder, was Counting the Money, preventing fraud and abuse in the VA's bonus payment practices for VA employees. I appreciate your insight on the issue why we called this hearing today. As a Navy veteran and a nurse practitioner, I know how critical it is for the VA to provide consistent, high-quality care to those who have served. I'm married to a veteran. I'm the mom to future veterans. I represent tens of thousands of veterans. My own parents are veterans. So it is an issue near and dear to my heart and to my district. I'm encouraged that the VA has decided against large-scale layoffs and is instead taking a more thoughtful and measured approach to improving operations. I also worked at the VA for several years, or for several months as a nurse practitioner. It was a short time because I'm a geriatric nurse practitioner and couldn't utilize my geriatric skill base as much as I wanted to. But I remember that there were a lot of really good people doing really hard work, the physicians, the doctors and nurses, the pharmacists, the allied health professionals, the people who were in one building taking care of people who walked through our front door. I also remember on my lunch break, I would take walks and see buildings full of other people that didn't provide patient care. I didn't know what they did, but I knew where I was called to work and where I was able to touch patients and to impact lives of veterans. So I think there is room, just as this was before my time in politics, just looking at what that facility looked like, knowing that there was room to probably downscale. I want to make sure that our best resources are going to the patient care. But reducing 30,000 positions through attrition rather than eliminating critical roles is a more reasonable path forward, and I know that's what the Secretary is focused on doing. I support efforts to streamline the department, and I give more decision-making authority to local medical center directors who are closest to the veterans they serve. Decentralizing operations can help VA facilities respond more quickly to local needs and improve overall outcomes for patients. At the same time, I'm closely monitoring how these changes may impact support staff who play a critical role in ensuring providers can focus on delivering care. I believe restructuring can be positive, but only if it's done transparently, with input from frontline workers and full oversight from Congress. The lack of clarity around some of the VA's reorganization efforts is concerning, and I will continue to push for more communication and accountability. Congress must be a partner in the process, not an afterthought, and the VA leadership must work collaboratively to keep veterans and employees informed. I will continue advocating for investments in VA services that prioritize patient care, benefits, delivery, and support for the dedicated workforce. Ultimately, this is not a partisan issue. This is about keeping our promises to those who've worn the uniform. Veterans deserve a VA that serves them efficiently, compassionately, and without disruption. Again, thank you all for being here today. I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include any extraneous material. Hearing no objection, so ordered. This hearing is now adjourned.